Hi, I'm Dr. Craig Bax. I'm the Chief Medical Officer, founder of the Cure Center for Chronic Disease, and CEO of Cure Coach Incorporated. Wanted to share a few thoughts with you after a recent survey that we took from our patients based on our newsletter. For those of you who haven't responded to the survey, we hope that you will take the time. Generally speaking, I guess you might say no news is good news, and we had very little criticism, thankfully, but I'm always happy to hear if there's things that we're not aware of that we need to fix. But I'm still happy to report that for 10 years, over 1,000 patients, we did not have a single stroke or a heart attack. I had one patient needing a stent based on failure of a stent that didn't need to be placed in the first place, and one person who had bypass surgery, but our follow-up was what led him to the realization that there was a problem that he wasn't aware of, and it was our testing that saved him from serious heart damage and enabled him to get revascularization with bypass surgery before the damage was done. But nevertheless, what I really wanted to talk about is how do you get this message out to your loved ones? I'm presuming that those of you who continue to work your cure plan with me are generally satisfied with our efforts, and although none of us are perfect, are doing the best you can to execute your cure plan. And I always say that it's not perfection that we're after or that we think is even possible, but we try our best to support progress to enable everybody to do better. So I think we need to celebrate when there are successes, like a reduction in body fat, which means less insulin resistance, or an increase in muscle mass, or a reduction in arterial age. And when we run into challenges, we just figure out what went wrong and do our best to get back on track. But some of the responses from the survey suggested that it is hard to share this message, even if we ourselves have bought into it. One of the recurring themes that I saw was that people just don't want to change. And there is a lot of that. But I would say when it comes to sharing information, even when you think they're not going to listen or they're not going to do anything differently, that's on them. I think the key thing is share the information, let the seed fall where it may, and then just leave the rest up to them and God, and just pray that it will take root. I think it's really important that we let our loved ones know that one of the ways that we show our concern for them is to do our best to keep them healthy. Now, part of that's selfish, because what if we depend on our loved ones in case we get sick to help us? But what if they become sick, disabled, or die? If you would arrange their funeral or come visit them in ICU or take care of them at home or find a nursing home for them, doesn't it make sense to spend a few minutes just saying, hey, I know a program that is helping a lot of people, include me, to improve my health in measurable ways, that my arterial age has gotten better and my weight has improved, or I just feel better in general. And I'd like that same benefit for you. And especially with couples, couples can help each other, or they can also undermine each other. So I like working with couples a lot. Because the success is generally so much better in general. So don't be afraid to share your successes, even if you're not entirely thrilled with your results. I know there's a certain sense of privacy about these things, but you don't have to go into a lot of details. One of the things that I also encountered early on, although I'm running into it less and less, and that is when I would tell people about this opportunity, they would say, well, I'm going to go talk to my doctor. And I think things are sort of changing in that respect. I would say that anybody who completely, unquestioningly trusts mainstream medicine today hasn't been paying much attention to what's been going on. And medicine has largely become bureaucratized. It's become a lot of groupthink. Most doctors now are employed, and although there was a time in my career when I thought that doctors were professional enough to resist the pressures and requirements of being employed, I have to admit that that was a very naive way of thinking about things. I've been in employed situations, and many years ago, there was still respect for the doctor's autonomy, and somebody who was employing them thought, well, it's best, I'm going to get the best results if I leave them alone and let them, be doctors. I don't think that's true anymore. I think doctors are, especially younger doctors, are under a lot of pressure. They have a lot of debt. They can't afford to lose a job. If you make waves, you find yourself being criticized and called from the herd. And so there's not a lot of room for independent thinking in medicine these days. So anyway, I think anybody who is thinking about the best interests of themselves and their family, who they support, should be thinking, what else is there that my doctor may not be able to tell me or offer me? And so I think that one of the key things that I want to emphasize about our approach is that it's optimal, that we don't settle for average results or the standard care, and that it's proactive, that we don't wait around for bad things to happen, that even before the check engine light is on, we do a safety inspection. And especially if the check engine light is showing any signs, we don't wait until the engine blows up before we do something about it. We pay attention to warning signs and find out what's causing them and get rid of those causes. So I think the ultimate message here is, don't be afraid to share your challenges, your successes, especially with those you love. What better way to show that you love somebody by making the gift of good health, improved health, available to them? I mean, even if their arteries are even a little bit or even a lot deplorable, and if that's true for you too, it's still possible to make your arteries younger, healthier, and even great again. So thanks for listening, and I look forward to working with anybody that you want to help to live a longer and more optimal life. Have a great day.